Lots of folks still coming on online, so thank you for joining us. Good morning, everybody. Welcome. We'll just go flip to the next slide here. And again, welcome to our PlanH 2026 information session for potential applicants and candidates for our program. So my name is Vanessa Manuel. I'm the Executive Director here at BC Healthy Communities Society, and I'm very happy to be joining you all again today for the 2026 PlanH grant cycle. I'm joined today by two of my colleagues, McCollum, who is the PlanH delivery lead, as well as Laura Chambers, who's our grants and engagement coordinator with BC Healthy Communities. We also have a number of our team in terms of tech, monitoring the questions and answers, as well as the chat. So lots of us here today to support you. So we're pleased to be able to share the details of the PlanH grants available for local and Indigenous governments. We do our best, and we will be doing our best to answer all of the questions that you may have today about the 2026 application process. And we're really hoping to get a sense of what communities are looking for and who might be applying this year. So next slide, please. Thanks, Pat. And before we go any further, I do want to take a moment to recognize that my feet are planted here on the grounds of the traditional territories of the Lekwungen people, including the Wasonic, Songhees, and Esquimalt nations. The ongoing historical relationships of Indigenous peoples with the land is recognized, emphasizing that these relationships are not simply historical, but continue to this day. The First Peoples have been here since time immemorial, and their history is long and rich. And I recognize that we're all calling in from various places across the province today and taking a moment to recognize where your feet may be planted and where you're joining us from today would be appreciated. All right, next slide, please, Pat. So just a quick overview for today for our agenda. We expect that our presentation will take about 20 to 30 minutes, and then we welcome everybody to stay for a question and answer interactive session for the final portion of the hour. I do kindly ask that as much as possible, you use the question and answer feature at the top of your screen for those questions. And this is what we'll be monitoring, as well as the chat section, but this is what I'll be referring to mostly for moderating our Q&A session towards the end. I love the chat feature and everything like that as well. I can see a number of folks recognizing and joining and adding some comments in there too, but as much as we can use the Q&A up next to the chat for the actual questions, that will just help us to bring our questions grouped nicely together. And just a quick reminder that our session today is being recorded, and it will be up on our website as well as our YouTube site. All folks who have registered for this webinar will receive the link after to the recording, as well as a few other resources and links that you can share with any other potential partners for that additional information, and so on. So there is no need for your AI recorders today, so we kindly request that folks do not use them. And we do also recognize that some of those will automatically join the session, and so our team will just kind of filter through there and remove those extra AI recorders, and we'll just make sure that everything is available on our website and through our communication channels post-webinar. And like I said, we've got several of our colleagues here in the background. So recognizing Pat, Gurmeet, as well as Stephanie are behind the scenes. They'll be adding links to resources, helping to moderate the chat function and take us through our session. Next slide, please. So just quickly, a little bit about us, some of the background here with BC Healthy Communities Society and the PlanH program. BC Healthy Communities has been operating across the province as a nonprofit organization since 2005, and we facilitate the ongoing development of healthy, thriving and resilient communities. We really strive to offer and provide a range of resources, programs, funding, other fee-for-service offerings that will support multi-sectoral groups to collaborate around a shared vision for a common purpose. I also like to highlight that our organization is really in a unique place where we operate at that intersection between planning and public health, very much adjacent to our provincial governments, our local governments, as well as other not-for-profits and organizations across the province. And so with that, I am going to hand the slides over to Erica McCollum, who's going to take us through our background with the PlanH programs.
Thanks, Vanessa. Hi, everyone. I am Erica McCollum, and I am the PlanH lead. And I am very pleased to be here today to talk about the 2026 PlanH grants. So PlanH supports local government engagement and partnership across sectors for creating healthier communities. And since 2012, BC Healthy Communities has provided more than 300 PlanH grants with in-kind support to communities across the province. And this is done in partnership with the Ministry of Health as part of the province's health promotion strategy. We are also able to provide additional funding for the healthy public policy projects in the Vancouver Coastal Health Region through funding provided by the Vancouver Coastal Health Authority. Next slide, please. So I just want to take a moment to talk about what we mean by healthy communities and our healthy communities approach, because it really shapes how we offer our grants and how we evaluate our applications. So really, at the core of the healthy communities approach is this recognition that the social, economic, cultural, and environmental context in which people live greatly affects their health and well-being. So this means it focuses beyond the healthcare sector or on individual choices, and instead wants us to focus on the ways that our communities are organized and planned that can affect health and well-being. And so then a healthy community makes it easier for people to lead healthy lives through community design, planning, and health promotion. And this means paying attention to things like our food systems, how our communities are set up to encourage connectedness, how our communities are set up to encourage recreation and physical activity, the access to green space. Do our communities have affordable, healthy housing? How inclusive are our communities? And these kind of other designs that make it easier for people to live healthy lives. The Healthy Communities approach also has 5 key pillars for action that we consider important for creating healthy communities. And again, these pillars really shape the way that we offer our grants. So the first pillar of the Healthy Communities approach is healthy public policy, or policies that are focused outside of the health care sector and focused on improving the health and quality of life of the community. And this shapes our grants in that this is a key funding stream for the PlanH grant. The second pillar of the Healthy Communities approach is community and citizen engagement. And again, this is the way you see this in our PlanH grants, is that we really look for this in your applications. How are you including citizen engagement in your processes or citizen connection in your processes? The third pillar of the Healthy Communities approach is multi-sectoral collaboration. And this just really means how are groups from different organizations in different sectors working together on a project. And again, the way that this comes through in our PlanH grants is that we like to see this. We like to see how you are thinking about working with different partners, and we ask you to list those potential partners on the application. And if possible, we love to see letters of support from these partners. The fourth pillar of a healthy communities approach is political commitment, or in other words, it's important, we see it as important to have political commitment to work towards healthy communities. And this influence is seen in our grants in that we require that it's the local government that is the key applicant or the primary applicant for our grants. And then the fifth pillar is actually called asset-based community development, but the way this influences our grants is more in terms of strength-based capacity building. And this just means that we want you to work on your project with the existing strengths from your community, and that we also want to hear from you what you think you're going to learn from doing this work, and how you think your community might be left stronger after doing this work. You can also see this focus on strength-based capacity building and some of the supports that we provide, such as webinars and community of practice that showcase the strengths and knowledge of the PlanH communities. Next slide, please. Another key aspect of the healthy communities approach that I've really talked about in other ways is that we focus on an upstream approach. And an upstream approach just means that instead of reacting to health crises that already exist, you're working to create the conditions that help prevent these health issues in the first place, or that make it less likely that they arise. And the way that this is depicted in this graphic is that it's a focus on building the bridge over the river instead of and keeping people out of the river instead of having to save them as they're drowning. Next slide, please. Okay, so the final aspect of a healthy communities approach that is important to understand because it influences what we look for in our applications is considerations of equity. Equity is a really key piece of the healthy communities approach. And an equity focus is the recognition that within our societies, and because of the way our societies work, some people have better access to health and well-being than others. And an equitable approach takes this into consideration and thinks about what the different needs that people might have to achieve the similar outcomes, and then provides different types and amounts of resources based on those needs. So an equitable approach is focused on achieving fair and similar outcomes instead of treating all situations in the same way. And again, this graphic, I think, is a really helpful way to show this. The equitable way of providing resources and support is represented by the greater number of boxes under those who are further from the fruit, so that all people can reach the fruit. What this might look like in the way that we look at our applications that we receive is we ask ourselves questions like, does this project pay attention to what groups which groups might need more resources or support in the community to achieve similar health outcomes? Or another way another question it might make us ask is, in terms of the project engagement, and what ways you are thinking about the voices that are often not represented, and how you work to make sure these voices are heard along with the louder voices. Okay, so that is the kind of key background on the Healthy Communities approach that really shapes how we offer our grants. And at this point, I'll hand it over to Laura to speak. Laura, the Grants and Application Coordinator, to speak about the application process.
Great. Can we have the next slide, Pat? Perfect. Hi, everyone, and thanks, Erica. Thank you, everyone, for coming today. My name is Laura Chambers, and I am BCHC's Grant and Engagement Coordinator. Today, I will review the application process and what you can do to make your application stronger. Over the coming feel free to reach out to me with any questions you might have. Links to the grant webpage are posted in the chat. You can also find these anytime on BC Healthy Communities website. As Erica mentioned, successful PlanH grant communities receive both funding and in-kind supports from BCHC staff. BCHC offers 2 grant streams through PlanH, and each stream focuses on different aspects of healthy communities. For 2026, our grant streams are community connectedness and healthy public policy. I'll review the eligibility criteria, the application and adjudication process, and some more details about each of the streams. Then I'll hand it back to Erica to talk about community supports. Next slide, please. So the first question for any potential applicant is, of course, are we eligible? And for the PlanH grants, a local government or Indigenous government must be the primary applicant. This includes municipal governments, regional districts, First Nations, and Métis chartered communities. You can see the full eligibility list on the slide along with some examples of who cannot be the primary applicant. We encourage those who are not eligible to partner with an eligible applicant. If you're a nonprofit or other community organization that is partnering with an eligible applicant, the eligible applicant would apply as the lead and list you as one of their partners. Next slide, please. As mentioned, our PlanH grant streams this year are community connectedness and healthy public policy. So we'll talk about each of those. Community connectedness grants provide up to $5,000 and in-kind supports and are suitable for projects that foster community building or foster connections between community members. Social connections are a vital aspect of healthy communities. This stream aims to reduce isolation and improve a sense of belonging in our communities. For healthy public policy grants, this provides up to $15,000 each and include in-kind supports from BCHC staff. Projects in this stream develop or amend policy to improve health and well-being of community members. Eligible projects might include policy analysis, public engagement in the policy process, research, policy implementation, or evaluation. Next slide, please. We are looking to see how your healthy public policy application supports provincial health priorities. In September of 2024, the BC Ministry of Health announced British Columbia's Population and Public Health Framework, Strengthening Public Health. The PlanH grant aligns with the 6 priorities outlined in this framework and includes best start in life, health impacts of climate change, communicable disease prevention and response, non-communicable disease and injury prevention, prevention and reduction of substance-related harms, and population mental health and wellness. We have provided guidance on the 6 priorities and how they fit the PlanH grant program in the FAQ section of the grants webpage. As a note, your application does not need to address all 6 of the priorities. And thanks to a partnership with Vancouver Coastal Health Authority, we will award additional healthy public policy grants to communities in the VCH region. There's no separate application that is required to be considered for that funding. And as mentioned earlier, each grant comes with funding and the options for support from BCHC staff. Next slide, please. So how to apply. Applications can be submitted online through a web form accessed on the grants webpage. The deadline to apply is June 2nd at 11:59 p.m. Pacific time. We recommend reviewing the application guide webpage before you complete your application. Applications must include a project overview, budget, and work plan. For the project overview, the application form asks about your project activities, goals, and expected results. You'll also explain how your project supports equity and how you plan to measure success. You can find a full list of the questions on our website to help you prepare. For the budget, you'll need to share a basic budget that shows the total cost of the project, not just what you would like us to fund. Be sure to include other funding sources like donations or volunteer time. Only 40% of our funding can go towards capital costs like equipment, furniture, or building work. For example, if you are applying for $5,000, only $2,000 of that can go towards capital expenses. For the work plan, include a high-level plan that lists major steps in your project and who is responsible for each one. There are templates for the budget and work plan on our website. They include examples to help guide you, and you'll be asked to upload your completed template during the application process. For supporting documents, you can upload extra materials like letters of support or reports showing the need for your project. We know that internet access can be intermittent in some communities. If using the web form to apply does not work for your community, please contact us at grants@bchealthycommunities.ca to make alternate arrangements. Next slide, please. So some application tips. Our goal is to support you to prepare the best possible application. Throughout the application guide webpage, there are tips on how you can strengthen your submission. These points to features that the adjudication team will be considering in selecting successful projects. In our adjudication process, we are looking for some specific things. We want to see projects that use an equity lens. Equity is most simply defined as leveling out access to opportunities, power, and resources. So is your project making a healthy community accessible to everyone, especially those who need it most? Is your project focused on a group that has been underrepresented at events or in policy discussions? Are you considering anti-racism and calls for truth and reconciliation? Tell us how equity is incorporated into your plan. Demonstrating meaningful partnerships. We're looking for collaboration with your health authority and groups within your community across multiple sectors. We have found in the past that partnerships make projects more sustainable over time. The partnerships don't need to be set up at the time of applying, but let us know who you see being part of the project team. Letters of support are not required, but please include them if you do have them. Partnerships are one way to make a project sustainable. If you have other ideas about how the benefits of the project will extend beyond the grant year, please share those ideas. If you have a plan to evaluate your project, please tell us. Are you going to be collecting data, like handing out surveys? How are you going to record this kind of information? The reason we are asking about evaluation is because it makes your project stronger and more sustainable. One bonus of including evaluation plans is that data collected can provide material to be included in your final report, which it would be due in October of 2027. And I'll discuss that a bit more in a moment. So review the guide or webpage. Make sure you review the application information on our webpage before finalizing your application. You can also email me with any questions, and some of your questions may be covered in the FAQ section of the grant webpage. You're welcome to book a consultation call with us to discuss your project idea. Next slide, please. And so this is a reminder of some of the key dates. Deadlines to submit your application is June 2nd. We will notify applicants of the results in August. And for selected projects, funded activities can start as early as September 1st, 2026, and must be completed by September 30th of 2027. So please ensure in your work plan that you've aligned with those dates. There is a requirement to submit a final report, including a financial report by October 1st of 2027. 20% of the award amount is held back until the final report is completed. This report is similar to the application form. We're interested to hear how things went, what has changed because of your project, and what have you learned. So that completes my overview of the grants, and I will pass it back to Erica to talk a bit more about how BCHC can provide supports along with funding.
Thanks, Laura. So just to recap, the PlanH grants include both A, cash grant, and B, in-kind supports and resources. To say a bit more about the in-kind supports, or the way that we help strengthen community capacity. For grants participants, the onboarding process itself is part of that support. Here we talk more about your project in depth and get a sense of the ways that we might support along the way. Another key aspect to support for our grant recipients is our community of practice calls. This is where we support knowledge and resource sharing between communities and kind of facilitate that forum. And then we also, by request, provide individualized supports such as strategies for planning, monitoring, and evaluation, and document review and feedback as some examples. And then we also have supports for everyone through our website and through our newsletter and social media. We share resources and our action guides on specific healthy communities topics. We also share these action guides with our grant recipients if we have the ones that we have on specific topics that we think will be helpful. So please check out our application guide for more details on the types of in-kind supports we provide to our PlanH funded communities. If the type of support you need isn't listed, please don't hesitate to reach out and ask about that support. We always try our best to help in whatever way we can. Next slide, please. So thank you everyone for joining. We will move into the question and answer portion in a moment, but I just want to share our contact information and encourage you to please contact us. We strongly encourage you to reach out with any additional questions you have about the application process or your proposed project until before the June 2nd deadline. And you can reach Laura at grants@bchealthycommunities.ca or schedule a call. And you can reach myself at erica@bchealthycommunities.ca. So now we can move into our question and answer portion. And if you have not yet, please post your questions in our Q&A tab.
Perfect. Thanks very much, Erica and Laura. So I do have a question in here already that I'll read out. So just some clarification around partnerships. Should roles of different partners already be clearly defined at the time of applying, or is it okay to list partners that we have established relationships with, but haven't necessarily met to discuss the specifics of the project?
So I can answer that one. It is okay to list any partners that you have established relationships with, even if you haven't discussed like the details of the specific project. You can also list anyone that you think might be a good partner that you are planning to try and reach out to, even if you don't have an established relationship at this
Well.
I think there's another one about if a group can apply for both community connectedness and healthy public policy streams, or is only one application for one stream accepted? So I can answer this one as well. You can apply for both streams. It is unlikely that you would be funded for both streams, but you are welcome to apply for both a community connectedness grant and a healthy public policy grant.
Perfect. I see actually there's some follow-up questions as well from the first one. Again, back to the partnerships. How many of each of the two types of grants are available? Oh, so I can speak to that. We don't have a set number of each type of the grants that are available. For the 2025 year, for instance, it just ended up being a 50-50 split. We do have a budget that we work within in terms of the grants that we provide. So it's really, again, when we're adjudicating the grants, marking them, and then looking through those priority ones that we're going to fund, that will kind of dictate how many grants we end up having. So if we have, a whole bunch of community connectedness applications that are very strong, those grants are $5,000. So we would be able to fund quite a number of more, whereas the healthy public policy grants are $15,000. So it's just what we have to do within our budgets. And with that, were these given last year? And do we have some examples of projects from other years? Yes, we have been giving these grants out in various forms since 2012. And there are examples from last year. If you float over to the chat section of the webinar here, Stephanie did post about 5 different community examples from previous years that are great. We also on our website feature community stories, and we've been bolstering some of this up. So these are kind of more like blog posts for folks to be able to read and review and look to understand and learn more too. Okay, and then the next one that I have here is, can this grant be accessed if you already have a grant for the same project? Lo or Erica, I'll let one of you
take this one. Yes, the grant can be accessed if you have a grant. I'm assuming this year's grant, but your grant has to be, your final report has to be submitted before we can release the money for the new grant. Lo, do you want to add anything to add to that?
Yeah, so even if you don't have, so Erica provided a good example of if you have a PlanH grant currently and are looking to apply for this year's funding, but if you have additional like supporting funding or that's not from BC Healthy Communities, you can include that in your budget, just showing that there is additional funding that you have received towards this project. It just would need to ensure that this project hasn't already taken place, that the activities that you are looking to apply for are ones that have not taken place yet.
Mm-hmm. And I'll add just another point in there as well too. So if you have a grant from a different source that's also funding the project, just reflecting on what Lo said, like we just need to know specifically what our portion is. And then when you submit your project budget, that would need to be clearly defined, like that you've got funding resource from another organization that's paying for X. BCHC is paying for Y. You've got in-kind support for A, B, C. So yes, you're welcome to pool things together. And in the past too, we've seen these grants really be leveraged into much bigger opportunities that have led to additional funding from other larger resources as well. And so these are all fantastic things that we like to see. We just need to know clearly where our funding is supporting versus where the other resources are coming from. All right. And then will a policy planning stream be offered in the future? The June 2nd deadline is too soon to receive, review, and approve from our local governments to submit a proposal. So at this time, our grants are on a year-to-year basis in terms of our funding that we receive via the Ministry of Health to support this program is on an annual basis. So right now we've got the funding to support, we have our age-friendly 2026 grants, which are underway and we're preparing for adjudication for next month. And PlanH, of course, is right now. So we don't know if we will have funding for grants next year at this time. Okay. Can this, and then Lo, you spoke to this a little bit, but maybe just a bit more. Can this grant be applied toward growing an existing project or only new projects?
So it can be used for an existing or growing an existing project. It just needs to be clear that there is some new activity that you are applying for. So some new aspect of that project should be included in your application.
Great. The next question I have here is, do having more than one application from the same community affect how they may be assessed?
We look at things both individually and over all of the applications that we receive. So I don't believe that it would affect how they will be assessed. We just take that into consideration, more so the general spread of where applications are coming from.
Yeah, so communities often we do have, especially the larger communities, submit multiple grants from grant applications because they're from different areas of the local government or indigenous government, and they're very different projects. So we do, when we are adjudicating, we do recognize that we may have multiple from one community, but they're also very different and impact different areas. Another question, is there a PDF copy of the application questions available for this grant? It's very helpful for when you're working with others.
Yes, there's both a PDF version and a Word document version. The Word document version can be helpful because you can copy and paste directly into the application web form after. Both of those are listed, like a link is provided on the first page of the application web form, and I believe on our website as well.
Excellent. Just going to double check the chat here. There's those examples still from Stephanie. It's the last post in the chat. So thanks everybody for also using the Q&A session. It makes our lives a little bit easier when we're going back and forth between different platforms here. Okay, thank you, Stephanie. She just replied to the last comment in the chat from Nancy with the link to the PDF application guide. I see a third comment on one of them down. Oh, Alyssa, thank you. Posted some examples there as well in response to some one of the first comments about previous project examples. Just give it another few minutes here too. Rico. Excellent. Okay. Got a couple more questions in here just now. So, how closely must an applicant work with their local health authority to be successful in obtaining a grant? I'm wondering how this is scored on your end. Do either one of you want to start with that? I'm happy to also speak to it.
I can start. We encourage you to work with your health authority, and if you don't have a relationship, we really like to help support that connection, but we don't score your relationship with the health authority.
Yeah. So that's one thing again about the support and everything like that we like to provide if you don't have a relationship with your local health authority. And it is a question that we ask as a part of the application form that if you would like us to connect you with your local health authority, regardless of your success with the application. So we would offer that to those who do not get a grant from us and for those who do. So we're really looking to help build those relationships. And another question here. I know often OCP, so official community plans, have been funded through this. Can you speak to whether other small policies have been funded, like agricultural plans?
I can't think of any agricultural plans off the top of my head, but we have funded healthy public policy grants that have focused on food security and also kind of like climate impact on food security. So those have been a couple of ones that we've funded in the past. We've also funded things that are focusing on different aspects of healthy communities rather than an overall community plan. So it really depends on the needs of your community.
Yeah. And this is maybe a little bit of a difference too between our PlanH grants and our age-friendly grants, where with age-friendly, the stream one, we're looking for an age-friendly plan to be developed as a whole. Whereas PlanH, it's broader. We're not unnecessarily tied to an OCP, so we fund a number of different smaller projects. Some examples that Lo just gave as well, but emergency preparedness, community connected events that bring together for food security, like preparing meals together, other projects that support, older folks or those that help to establish and connect relationships between elders and youth. We had a number of grants last year that focused on local food security or cultural events, building greenhouses to help support the community produce its own produce year round. Yeah, those are, Erica, any other ones like it's really far and wide.
Yes, that I guess that is the key point, is it really can be a lot of different specific topics that we include in healthy public policy. So yeah, there again some examples of the healthy public policy grants that were successful last year. There was an anti-racism strategy, a health needs assessment, a peer-informed homelessness plan, a framework for launching a harm reduction van, and policies for meaningful transition supports for families returning from people returning from substance treatment centers. So really, as long as it has a policy strategy, it's grounded in creating policy and strategy, and those strategies work towards creating healthy communities. It can be quite diverse what can propose.
And of course, fitting in with the Ministry of Health's population public health priority areas as well, which is a requirement. So. Awesome. These are great questions. I see our numbers are starting to drop off a little bit, but we are here. And if you don't have any other questions, folks are welcome to head off, but we will stay online until we see those numbers kind of wrap up. But if anything else pops up, please do connect with us. If anything comes up later, like we said, reach out to Laura at grants@bchealthycommunities.ca, and then Erica at bchealthycommunities.ca. We are here and available to support the development of your grant applications, answer questions, do what we can to support this process. So if things come up later, please do reach out to us, but we will stay online here in case anything else comes up.
And I just wanted to mention that we have a survey for anyone who has attended. If you could take a few moments to complete that survey, it helps us to inform on what people would like to see in this grant info session. And there's also an opportunity to ask additional questions that may come up. And Stephanie has just shared the link to the survey as well as to 2 registration links for upcoming webinars that we have.
Thank you, Carrie. And thanks everybody for your time too, for joining us.
Okay.
Oh, we got another question in here. Where can I find specifics on your previous policy planning grants focused on food security?
I think they are listed in parts of our website. And I'm not sure. I think there may have been a community story as well.
I think for that one, Tom, maybe reach out to us to chat about that. A lot of those kind of details are reflected in our final evaluation reports that we don't publicly post, but we can go and look through some previous examples of those food security, and we've got a number of projects underway right now, actually, with the 2025 grants that are focused on food security, and we would be happy to chat about some of those and take you through that.
think there's another question in the chat. Is there risk to consider build into the grant RE change in local leadership with the upcoming elections and if incoming municipal leaders are not aligned with the project? It's a bit of a tricky question.
Yeah. And we know with the upcoming local elections, like we were very cognizant in terms of the timing of our grants this year and getting the applications open sooner than later. So with if there is a change in leadership with upcoming elections and there is no longer an alignment with the project, we do support changes in projects as long as they meet the original criteria on a case-by-case basis. So that would be one of the times where you would reach out to us, have a meeting, we talk about the project and what we could pivot. And sometimes it happens, right? Projects don't go as planned. Sometimes something takes much longer than anticipated. So we are here to work with the communities to support and to modify those plans. And we would go through a process of recognizing that what needs to change, what can still maybe stay, and ensure that it's all still within the parameters of our funding guidelines and everything, and work with the community where they're at. It's the reality of things some days. So that's a great question. Upcoming. Oh, thank you. Yes, we've got our upcoming age-friendly community webinar on April 28th. So thank you for posting that. That is available for registration as well too. We also have another webinar that we're supporting in partnership with Vancouver Coastal Health, the City of Powell River, as well as UVic in mid-May on May 13th. That is looking at the child and youth mental well-being projects that we worked with VCH through. And that webinar is titled Advancing the Accessible BC Act, a community belonging project shares recommendations for all municipalities. So that's also open on our website for registration too. And thanks, Lo, for sharing that.
Okay, I think we're dwindling down in numbers, so I will end the event.
Perfect. Thank you very much, everybody.
Thank you.